Hello and welcome. Today, we're diving into the fascinating and often perplexing world of perilymph fistula, a condition that can significantly impact hearing and balance. We'll explore what it is, what causes it, how it's diagnosed, and what can be done about it. Perilymph fistula, or PLF, arises when there's an abnormal leak of perilymph fluid from the inner ear into the middle ear. The most common causes include head trauma, such as a blow to the head or a sudden change in pressure, like from scuba diving or airplane travel. Less frequently, it can occur after ear surgery or even from forceful straining, like heavy lifting or violent sneezing or coughing. In some instances, the cause remains unknown, classified as spontaneous PLF. To understand PLF, we need a quick anatomy lesson. The inner ear houses the cochlea, responsible for hearing, and the vestibular system, responsible for balance. These delicate structures are filled with fluid, including perilymph. When a fistula, or a tear, develops in the oval or round window membranes of the inner ear, perilymph leaks into the middle ear. This disrupts the normal pressure balance within the inner ear, affecting both hearing and balance functions. Imagine a balloon with a tiny hole. The pressure inside will be altered, affecting its shape and stability. Determining the exact prevalence of perilymph fistula is challenging. Many cases may go undiagnosed or misdiagnosed, as the symptoms can mimic other inner ear disorders. It's believed that PLF is relatively rare, but it's seen more often in individuals who have experienced head trauma or have undergone ear surgery. While no specific demographic is immune, those participating in activities with high pressure changes, like scuba diving or skydiving, may be at increased risk. The symptoms of perilymph fistula can be quite varied. The most common include hearing loss, which can fluctuate, and tinnitus, a ringing or buzzing in the ear. Vertigo, a sensation of spinning or dizziness, is also a hallmark symptom. Patients might also experience imbalance, nausea, vomiting, and a feeling of fullness or pressure in the ear. Interestingly, symptoms can be triggered or worsened by activities that change pressure, such as sneezing, coughing, or straining. Diagnosing perilymph fistula is often challenging, as there's no single definitive test. Diagnosis relies on a combination of patient history, a thorough physical examination, and various audiometric and vestibular tests. An audiogram can help assess hearing loss, while vestibular testing can evaluate balance function. A fistula test, where pressure is applied to the ear canal, may elicit vertigo or nystagmus, involuntary eye movements, if a fistula is present. High-resolution CT or MRI scans may sometimes be used to rule out other conditions, but they aren't typically diagnostic for PLF itself. Exploratory tympanotomy, a surgical exploration of the middle ear, is sometimes used to directly visualize and confirm the presence of a fistula, but it's reserved for cases where non-invasive methods are inconclusive and symptoms are severe. While there aren't strict classifications of PLF, it's often categorized based on the cause as traumatic, barotraumatic, pressure, related, post-surgical, or spontaneous. Understanding the cause is crucial for guiding treatment decisions. Treatment for perilymph fistula typically begins with conservative management. This involves bed rest, avoiding activities that strain or increase pressure in the ear, and sometimes the use of anti-nausea medications or steroids to reduce inflammation. If conservative measures fail to improve symptoms, surgery may be considered. Surgical repair usually involves exploring the middle ear and patching the fistula with tissue grafts. The goal is to seal the leak and restore the pressure balance within the inner ear. Preventing perilymph fistula is not always possible, especially in cases of trauma. However, certain precautions can be taken to minimize the risk. When flying, use techniques to equalize ear pressure, such as yawning or chewing gum. If you're a scuba diver, follow proper diving procedures and avoid diving when you have a cold or congestion. After ear surgery, carefully follow your doctor's instructions to avoid activities that could strain the ear. The prognosis for perilymph fistula varies depending on the severity of the leak, the promptness of diagnosis, and the effectiveness of treatment. In many cases, conservative management or surgical repair can lead to significant improvement in symptoms. However, some individuals may experience persistent hearing loss or balance problems. Recent research is focusing on developing more accurate diagnostic tools and less invasive surgical techniques. Studies are also exploring the potential role of regenerative medicine in repairing damaged inner ear structures. We are constantly learning more about this complex condition, and advancements are being made to improve outcomes for patients with perilymph fistula.